When you're going into the home, you're seeing, like you said, their home environment, and that plays a part into their symptoms.
So we had a guest on recently, Dr. Michael Malofsky, very interesting gentleman who has morphed his practice into more of a concierge or direct primary care practice, and he actually does home visits. So, is there a component of integrative medicine that there are home visits? And he feels strongly about it because he gets to experience what the family is really like in their home environment. Of course, the emergency department and even an integrative medicine clinic is an artificial, or the hospital's an artificial construct. It's not where the child usually lives. They have a
Yes.
life outside, and we're taking them away, as you referred to earlier, when things get better when they're away, but it's not necessarily reality. So,
Mhm.
what are your thoughts about home visits?
Yeah,
Have you thought about it at all?
'cause that's
Uh-huh.
how physicians used to do it, 200 years
Yeah.
ago. You used to be the
100
physician in
years ago. 100
right,
years.
you used to be
Yeah,
the
yeah.
physician in town, and, you would do everything. You would be the family doctor, the pediatrician, the OBGYN, the surgeon, and you would go to home calls and, deliver a baby and then go to a sick grandparent who's, dying. You would do all those things as the town doctor, and now we're just so specialized. And a part of me does romanticize that aspect of medicine. That I romanticize that aspect of healing because, like you said, it's not enough to see the patient. You have to meet them where they are. And when you're going into the home, you're seeing, like you said, their home environment, and that plays a part into their symptoms. If I walk in and all I smell is cigarette smoke and I'm here for an asthma attack, maybe I know what's going on. Or if it's somebody with, functional abdominal pain, and you notice that maybe the home situation is lacking in whole nutritious foods, and maybe there's something to say here. So I do think that I think home visits, if that is the future, that would be wonderful. But I think home visits will definitely make for better care. You can spend 90 minutes with them and have very tailored, individualized management plans. And that makes them feel seen and not just dismissed.